you need to have this done because there are a lot of health issues related to your circulation, anything with periodontal disease, implant surgery. It's amazing. Dentistry is just changing, it seems like, every day. I have a book in my hand you should have from Dr. Brian Evans and Dr. Barry Weiss. They're from Advanced Periodontics. Gentlemen, welcome to WQUN in the Friday Marketplace.
Thank you.
Thanks for having us, Ray.
Yeah, and, I'm going to throw this out and you can decide who answers the questions here in terms of periodontics. People, they're a little edgy, they're nervous, let's face it. I'm going to speak for them. They're nervous when they think about anything going dentistry, teeth cleaning, you know, having a root canal and all the other things they think about. The science today, the technology, is so far light years advanced from even 10 years ago.
Absolutely, and I think, you know, just to emphasize the prevalence of periodontal disease today, the Center for Disease Control just put out that half of the American population over the age of 30 has periodontal disease.
It's amazing.
So it's out there, and you're right, our technology has improved with regards to when we were in training, what we had to offer patients. Today we just have more with regards to materials and things to improve their periodontal health. So we can talk a bit more about that. But our book, we wanted to do the book to give patients more information out there because there's so much focus on the way teeth look and the perception of what is cosmetically pleasing, but there's not a lot of information about health of the gums and the teeth, and so that's more of what, as periodontists, we do.
You know, I'm amazed when you cite that statistic because even taking a look here, you also talked about periodontal disease in children. You know, we think about children, their bright smiles, and we think of them maybe needing braces or something like that. There are now kids who in their teen years have very poor dental health. What's going on?
Yeah. Well, you know, most of the situations with children are unfortunately related to some systemic diseases. For the vast majority, children may have a gingivitis condition, but not a periodontitis condition where they're losing bone around their teeth, and that's usually really more associated with certain systemic conditions, fortunately most of which are pretty rare. In certain inner city, say, populations, there's an increased rate, and there always has been, and we don't really know why for that.
Yeah.
For that reason.
One of the things, too, we keep hearing about guidelines for dental health. Get your teeth cleaned twice a year. So what's wrong with 3 times or 4 times a year? Sometimes 4 times a year could be, for a certain patient, could make a lot more sense.
Yeah, I think, you know, a long time ago, the idea of twice a year kind of came from a television commercial about a certain toothpaste, and it was based really not on any scientific data. And for the vast majority of people, that actually works, but there's a smaller segment of the population that really need 3 or 4 times a year, and unfortunately, the insurance companies don't want to recognize that. So that's always a battle that we have, but
it's an investment.
But it's an investment, absolutely.
Yeah. Describe exactly, and in your book here you have some wonderful photographs and a lot, I mean you can learn right here what the problem is. Periodontics and bone problems. You could see somebody with a really nice smile, but lurking underneath, it's kind of like wood rot or termites on the sill of your house. Everything looks great from the outside, but inside there's a problem.
Right, and I think, you know, periodontal diseases, there's different forms of it. The early disease is basically where the gums can become inflamed and swollen, and someone may notice that, and that's due to the harmful bacteria that collects in our mouths. We call it plaque, and sometimes it just stops right there in terms of its progression, but then it can become worse, and that condition is called periodontitis, and that's where basically the gum pulls away from the teeth and the bone that supports the teeth becomes eroded, and as that happens, teeth become loose and literally they could fall out without treatment. And you're right, the patients can look in the mirror and see maybe some red gums, but they don't know what's going on underneath the gum, and so if teeth become loose, that's definitely a sign. Bleeding gums when they're brushing or even when they're eating. And there are certainly inherited genetic risks that we're just now as you mentioned, the technology and what we've been able to focus on. A lot of the focus now is on the genetic aspects of periodontal disease, and we know that those patients who are more genetically inclined or susceptible to the disease do require those more cleanings a year.
Yeah, that's important. And also, the one thing that also has changed, never mind the periodontal aspects of this, but implants. Implants have just changed everything now.
Very sure.
And slowly but surely, insurance companies recognize you're not just going to put one little implant in once a year, that we can actually get beyond that. And for some people, especially those folks younger, that is the way to go.
Yeah, yeah, absolutely. That's probably one of the biggest technological advances in dentistry is the implant aspect. And I'd say it's probably about a 10 to 15% increase every year in the marketplace of implants. And it's really also changed our thinking and treatment planning for patients. Dentistry has always been about preservation of the natural tooth. But unfortunately, sometimes the patient will have to go through various dental procedures just to have that tooth fail maybe 5 or 6 or 7 years later, and they've been through that. And with the internet and the growing implant population, the word is really spreading more and more patients are asking, why don't we just cut to the chase and just remove the tooth and place an implant? With the advantages of an implant being that the implant will never get decay, unlike a tooth will, you know.
Yeah.
So what we always tell our patients is we certainly can't guarantee it, but it's the highest likelihood that it will last the rest of your life.
Yep, instead of those bridges.
Yeah, instead of a bridge, which puts the adjacent teeth at risk. So it's the most natural way we have of replacing a tooth.
Yeah.
Probably the most predictable way.
Great. Well, you do have a book. I just look right here on your radio. I have it right here. Everything you need to know about dental surgery. It's a great guide. Successful periodontal implant surgery. It's well explained. You get an idea of how the procedures work, why it's important. Also about gingivitis and then periodontal disease, really, how it can attack the whole body. It's not just about your mouth. They're located right here in Washington Avenue, in Suite 207 at 60 Washington Avenue. Advanced Periodontics PC. The office number is 203-288-5916. Website is easy. It's Hamden Perio. Hamden, P-E-R-O, as in periodontics. HamdenPerio.com. Authored by Dr. Brian Evans, Dr. Barry Weiss. Gentlemen, thank you so much. We'll learn a lot.
Thank you.
Really appreciate you having us, Rick.
You bet. And right here in Hamden Regional Chamber of Commerce. Good to see you both here this morning. Everything you need to know about dental surgery. We'll be back. Dr. Natan Bauman's going to be joining us too. Don't go away. This is Friday Marketplace with the Hamden Regional Chamber of Commerce.